Welcome to the Pen Leader Podcast, where strategic leaders get straight to the topics, strengthening our awareness and sharpening our minds. The Pen Leader Podcast is produced by Roar, a production division of Mays & Associates Ltd. Find out more at www.maysassociatesltd.com. Now here is your award-winning host, Dr. Shanda Gore.
And welcome back to the Pen Leader Podcast. Today we're going to be talking about nursing a career. And I am so glad to have with me Dr. Greg Guzman, who is the Vice President in Financial Aid Services and Government Liaison for the Hondros College of Nursing. And that's part of the American Public Education, Inc., serving over 110,000 students worldwide. He has so much experience, actually more than 28 years experience in higher education, public, private, proprietary sectors, and he is highly successful in executive leadership, turnaround management, enrollment management, financial aid, admissions, student affairs, strategic planning, curriculum development, philanthropy, and fundraising. Just amazing. And I'm so glad to call him friend. So please welcome Dr. Greg Guzman. Hi, Greg.
Hi, Dr. Gore. Thanks for having me on today.
Yes. So you have such an outstanding career in working in higher education and in financial aid and just helping students get to the next level. I'm first going to talk about your passion. And I mean, really, truly, all this work that you're doing, what are your main passions?
You know, I've always had a passion for higher education in particular, but not just because of the role it plays in our lives, but because of the change element associated with higher education. You know, so many individuals get stuck in a rut or they're not sure what they're going to be able to do with their life. And then there's that magical tool. I think Nelson Mandela said education is the most powerful tool or weapon that you can use to change the world. And I've had the great experience of actually using that to change lives of individuals today who lead organizations, who run cities, who help administer to the poor. It's just been an incredible life.
Well, you know, when I see that you've got this title, financial aid as well, and I know you've been a campus president, you know, talk to me a little bit about what that's about, especially with so much going on with financial aid.
Sure. Financial aid it's been a tool that made a big difference in my life. I actually attended Bowling Green State University in Northwest Ohio, and I did so only because of an extremely small grant that I received from the school. It was a scholarship, and it was designated and specific for individuals with a minority background. Specific in my case was a Latino background. And I really wasn't even thinking about going to college. I was going to take the route that many individuals, which is wonderful in my area, do, and that's head into the workforce, the labor force. And then I got that scholarship. You know what? I'm going to give this a try. And next thing you know, I have a PhD in higher education many years later, but it made such a profound impact on my life that I wanted to use that tool, and I have, to change the lives of others. And essential to that is federal financial aid.
Mm-hmm. Now, because you're working so much with nurses as well, because that's a focus, and again, you oversaw a campus that focused on nursing and nursing career, you know, what are you seeing in the trends with nursing education?
Nursing education had a big turn when COVID in the United States hit. We had a nursing shortage. We saw nurses from across the country retiring, resigning, and some just leaving the field because of the danger of it at the time. Well, we began to see a big shift in those who wanted to work in nursing, those who wanted the career and the education to pursue it. It really became localized. What do I mean by that? You know, education in the United States was really designed to administer to and educate individuals in a very localized area. However, over the centuries, the decades, we've seen it evolve, and it's become more of a nationalized approach. When COVID hit, we saw the world shrink again to our local communities, our neighbors, our friends, those that we wanted to assist and help. With nursing education, the biggest change I've seen is that localization. So now it's your neighbor, it's my neighbor, it's that individual that started a college education. However, then life got in the way and they went a different path. But now they want to come back and they want to be a part of that workforce and make a difference. During COVID, we called nurses and doctors heroes, as they should be. And so many of our friends and neighbors are now entering that specific field and making a difference. That's where I've put my focus.
As a leader in education over a number of years, you've advised others that have been in the field. I know I've coached as well. What are you advising right now leaders to think about concerning higher education and these healthcare careers?
Many of the leaders I speak to today and the organizations, so let's talk about many of the large health organizations that are in such need of nurses. They're coming to us and saying the same thing. They need local individuals. So at colleges and universities across the United States, we see so many students go off to college. When they get that nursing education, they then leave the local community. And so many of our employers and healthcare organizations are saying, hey, what about the adult learners? What about those students who are our neighbors, our colleagues, our friends? And they want them to be from that community. So we're really seeing that shift, wanting perhaps a fresh out of high school student over to the adult learner who is localized, who's stable, who is already a part of that community, make a difference in the nursing field.
What are you seeing in the numbers? Because you talked about shrinkage during COVID, but what are you seeing the need, the demand now?
We're seeing a definite increase in the demand for nursing education. At Hondros College of Nursing, for example, the last 4 years, we have had more students pass the nursing examination than any other college or university in the entire state of Ohio. And for your worldwide listeners, the state of Ohio is one of the largest states in the entire country. And what that tells us is that not only are individuals looking to pursue the career in the field, but the demand in the marketplace it doesn't seem to be slowing down. I'd like to give the example of the state of Michigan, which is just north of Ohio. The state of Michigan, in the next 25 years, the majority of their population will be over the age of 65. And they're going to need someone to take care of all of that population. So that's going to fall back to a lot of the nurses, not who are just necessarily fresh out of high school, going to college, but instead their neighbors, those that perhaps are in their 30s through their 50s.
So that age has, you said, again, non-traditional students, a focus on that. Are we talking like 5, 10,000, or are we talking tens of thousands in demand throughout? I know, again, you have a national university connected, but are you seeing tens of thousands, like these jobs are popping up, and then people, do they have enough people to even fill them?
No. So right now, the nursing shortage remains strong, if you will, not only in the state of Ohio, but across the entire United States. The demand is such that we have recruiters coming to us from across the country looking for individuals. And in fact, they are stepping forward and helping to pay for those individuals who are maybe 2 terms in, 3 terms in, and fund their education in exchange for them coming to work for their organization. So where you and I may have gone when we went to college, we were recruited, hopefully, right after school, right after we completed. Our students are being recruited, we see, before they even complete their 3rd term in college. And it's someone stepping forward, an organization saying, hey, we've seen you do good work in school. We would really like to have you as part of our organization. Could we have perhaps fund your education in exchange for you coming to work for us for X number of years?
So it's really, this is a dream situation for a student to say, I've got a job waiting for me. I just have to get through this part of my schooling, and then they're paying for my school, and then I'll have a job at the end of that rainbow, which there's some students that are graduating, they don't have that.
It's not only, it's a dream situation and dream opportunity for those individuals that have gone through college. Maybe they started off in a particular path, and maybe they wanted to be a history teacher, and maybe they were. But now they want to work in the field of nursing. This is an incredible opportunity for them to take and use credits perhaps that they've already earned at other colleges or universities and go to nursing school instead and pursue what we began our conversation with, passion.
That's excellent. What are you looking for? What are many of them looking for besides the fact that they're in school and they're going through their studies and are doing well? But what other qualities do leaders look for when they're doing hiring of the students?
I would suggest that many of the organizations that come in and are looking for students, an empathetic nurse, someone who has had those life experiences, right? So we're coming back to that adult learner that we were talking about. They understand what an individual is going through, not only in terms of their education, right? That's a given. You have to know how to perform particular tasks. But very important to them is the fact that they've had life experiences. Perhaps they have lost a loved one who's close to them, and they understand the importance of someone being able to communicate messages and information to them. I think it's also important that organizations are looking to hire individuals that are local. So it's not just someone that's coming in from the outside to take care of you or your family member. It's someone who lives in your community and understands where you're from and what you're about.
Could you explain a little bit of what you're seeing perhaps in the private sector where nurses are working for themselves and going into the homes? When you talk about localization, I know that doctors are starting to do it where sometimes they call it boutiquing, but they're actually, you call and the nurse comes to you. You're not going to go see the nurse. Are you seeing that trend as well?
Yes. In fact, we're seeing, it's a broadening, just as it has with any field or particular career track that you're on. You're seeing also a broadening in the nursing field as well. Well, they're no longer just nurses that are in hospitals, right? So that's a traditional thought. I work in a hospital because you're a nurse. Well, no, you might work in a clinic. You might work in a nursing home, right? That need is huge right now. I can't even begin to stress those numbers. That's growing. Nurses work in athletic related fields. I once had a student who had completed, and she was a medical assistant. Where would you think she came out and worked, right? Well, maybe a doctor's office or a hospital or maybe even nursing care. No, she worked in a Planet Fitness type organization because that type of facility wanted to have someone on staff with that type of expertise that could tend to their clients and their needs. So you're really seeing a broadening of the nursing field.
Now, paying for school, such a discussion over and over again. And again, in your role serving as vice president and focused on financial services, what are you seeing with the cost of going to school, the lucky ones, the great opportunities for employers to come in and pay for it, but not everybody has that. What are you seeing, and what advisements are you providing to families and the adult learners coming in who are seeking funding?
Sure. Federal financial aid is such it can be a tricky field. I've been doing it or involved in it for at least the past 28 years now. And I've seen it both go forward, backwards, in some cases stay stagnant. But it all begins, of course, with one application, and that's the free application for federal student aid that we all know as the FAFSA. This year, it has gone through the largest change in the past 40 years. To say that the rollout of the new improved, or as the Department of Education calls it, better FAFSA, has been smooth would not be an accurate statement. It's been very tough on colleges and universities. In fact, even those in this field. By some estimates, those financial aid administrators across the country, we are polling individuals just to see. It looks like about 56% may leave the entire field because it's become so regulated, so political in many ways, that they no longer wish to do it. Now, so what's that mean for families? Still apply. You need to fill out the FAFSA application. That's the key indicator that tells schools, hey, this individual may qualify for X amount of federal funding, state funding, or even institutional funding. To the nod of the Department of Ed, the FAFSA is so much easier than you and I used to fill out, right? When you and I filled it out, it was 12 to 15 pages long.
It was long. Pages and pages.
And you better know your IRS code and all the regulations that go along with that. Well, now it is down to 3 pages. If that. The number of questions has been shrunk tremendously. And the best part of it is it now ties to your filing with the Internal Revenue Service here in the United States. So it is faster. It is easier. and it is cleaner to complete when you check all the check boxes. That means that individuals pursuing college education that fall into traditional boxes, it's very easy for them. For students that perhaps have a parent that may not have a social security number, it gets complicated. For individuals going through challenges in life, such as a separation or a divorce, it gets more complicated then. And then the Department of Education has redefined who completes the FAFSA. And I can put that in the context of a dependent student. So a student, 18 years old, fresh out of high school. Now they don't have parents. They're called contributors who must complete the form. And it gets slightly more complicated.
This is your favorite word right now, complicated.
I'm being kind. We're on the air. So it can become confusing for students who perhaps have split families, who have 4 parents as opposed to the 2, whose information, who becomes the contributor. So turning to the financial aid offices at the schools, they typically and generally help students through that cumbersome pathway.
You know, I have to ask for the PIN leader is what are the qualities that you need to have to be able to do this type of work? If someone's looking at, and I want to go in there and I want to try to help the next generation students go to school, you know, what kind of qualities to be a leader in this field?
To become a financial aid administrator?
All of it.
Right. Well, to become a financial aid administrator, I think it typically begins with passion, and that means caring about individuals, caring about students, and understanding the power that higher education has to change lives. The task can be taught to anyone. A lot of people think we're so good with numbers and that we're like tax consultants. That's not the case. In many ways, it's regulatorily driven, so it's having a good understanding of what a particular administrative law means and then following that action. Yeah, I mean, if anyone's looking to become, you just got me excited here about this, Dr. Gore. Yeah, financial aid administration is an incredibly wonderful field. You get to help so many individuals, ones that you don't even know that you're helping. And I'd love to share a story about that. I was at our National Association conference last summer, and the speaker on stage was the president of our National Association. So he helps or oversees about 28,000 financial aid administrators across the country. And I went up to thank the young man after, he gave his presentation. He did a wonderful job speaking and talking about financial aid and the changes he's hoping to make with Congress. And so I let him share his story. And I said, well, how did you get involved? How did you get involved in financial aid? And so he begins to tell me his story. And turns out he's from my hometown. And I very well may have done his financial aid night when he was in high school because I did it for his high school. And, that was pretty wonderful for me. That was an incredible accomplishment. Though I may not have been a direct influence, I had an impact on this gentleman's life who now gets to change the world through so many other individuals. So that was a pretty incredible experience.
And that speaks a lot about your leadership.
Well, thank you.
I can't thank you enough for coming on and talking about the challenges and with financial aid right now, financial services. Thank you for the advisement for those who are looking to be leaders in the area, and some advisement for those that are sending somebody off to school to really get connected with their financial aid offices as soon as possible, especially if they're struggling with the FAFSA. I thank you so much. I really appreciate you.
Thank you.
Excellent. And so for our listeners, please make sure that you like and share the podcast. You've got some wonderful words here of what's going on, especially if you're thinking about becoming a nurse or leading or having discussions with those who want to be nurses and how there are opportunities out here to take advantage of. So until next time.
The Pen Leader podcast is hosted by Dr. Shanda Gore and brought to you by Mays & Associates Ltd., creating customized solutions for growth in the areas of leadership development, strategic planning, and culture building. Find out more at www.maysassociatesltd.com. Don't forget to subscribe to the Pen Leader podcast and share with others.